My name is Marieke Seiger. I'm the senior investigator of the research group of the Department of Dermatology, Nijmegen, Radboud UMC, the Netherlands. The majority of pediatric patients can be adequately managed with topical treatments, and only a small group should be treated with more severe treatments like phototherapy or systemic treatments like biologics and methotrexate. Currently, we reserve these systemic treatments for the more severe psoriasis patients because of potential side effects, adverse events, and laboratory monitoring. The evidence on efficacy and safety of systemic treatments in pediatric psoriasis is growing, and therefore the question rises whether we should start these systemic treatments earlier on. To support the discussion on early intervention in pediatric psoriasis and earlier start of systemic treatments in these children, we wanted to investigate the time until start of a systemic treatment and the persistence of patients on topical treatments.
We used data from the Child Capture Registry, a prospective, observational, longitudinal, daily clinical practice cohort of pediatric onset psoriasis patients. So 448 patients were included in the study, and all patients initiated topical treatment after psoriasis onset. During follow-up, 169 patients discontinued solely topical treatment. Of those patients, 113 switched to phototherapy, and 49 patients eventually switched to systemic treatment. Another 56 patients switched directly to systemic treatment, so about 62% was able to control their psoriasis with solely topical treatment. However, about 14% needed to switch to phototherapy, but did not switch to systemic treatment. And about 23% eventually switched to a systemic treatment. So 169 patients switched from topical to a more intensive treatment during follow-up. We were interested to find out what the median time was until these patients switched. We used a Kaplan-Meier analysis to determine the median time, which is the time until 50% of all patients discontinued topical treatment. And, as you can see, this was 7.3 years. We did the same to determine the median time until switch to a systemic treatment. And as you can appreciate here, the median time until switch to systemic treatment was 10.8 years. We further wanted to investigate what patient characteristics were associated with switching to systemic treatment. With univariable analysis, we saw that higher PASI and higher BSA, indicating more severe psoriasis, were associated with switching to systemic treatment. Also, a CDLQI above 5, indicating higher impact on psoriasis quality of life, was associated with switching. And psoriasis on visible areas such as the face, scalp and nails were univariable associated. But with multivariable analysis, we saw that only a higher PASI, so more severe psoriasis, and a higher impact on quality of life were independently associated with switching to systemic treatment.
The most important findings of this study are the fact that the median time until stop or discontinuation of a topical treatment is 7.3 years, and the median time until start of a systemic treatment is 10.8 years, which we feel is rather long. These data and this study add to the knowledge of treatment patterns in this patient group and enhance the discussion about earlier treatment intervention in this vulnerable and important subgroup of patients with psoriasis.